The easily identified symptoms are severe hypotension and anuria. Other symptoms are due to impaired tissue oxygen utilization, and there is a compensatory response of the body. So these are the various symptoms. Patient can have altered mental status, anuria, oliguria, low PO2 on ABG, altered LFT, high urea, nitrogen, creatinine, acidosis, high anion gap, increased lactate in the blood, hypothermia, tachycardia and tachypnea. These are the various symptoms which may be presented in patients of shock. So once we diagnose that this patient is of shock, so what type of shock the patient is having? So this is the classification of shock. It is usually of 4 categories. First is a hypovolemic shock, which can be hemorrhagic or non-hemorrhagic. Second is a cardiogenic shock, which can be due to ischemic heart disease, that is a myopathic shock. Patient can have valvular heart disease, which can result into a cardiogenic shock. And due to arrhythmia also, sometimes patients can have cardiogenic shock. The third type shock is distributed shock, which occurs in septic shock, adrenal crisis and anaphylactic reactions and spinal shocks. And the last is the obstructive shock, which is found in pulmonary embolism, pneumothorax, constrictive pericarditis, and these are the various types of shocks and their subsets. And all these shocks are different in type.